Hello, everyone. Again, this is Susan Wilburn, the Sustainability Director of the Network of Global Green and Healthy Hospitals. We are happy to have you with us today for the launch of the shared tool on saving energy through behavior change, low-cost solutions, and the presentation by our colleagues from the United Kingdom on these tools. We're really happy to have you with us. I'm going to spend a couple of minutes introducing those of you who are new to our network to the Global Green and Healthy Hospitals, and then I will be introducing our speakers for the session. The Global Green and Healthy Hospitals is an international network of hospitals, healthcare facilities, health systems, and health organizations, all of whom dedicated to reducing our environmental footprint and promoting public and environmental health. We have a 10-goal framework as the foundation of GGHH. It's a framework of 10 interconnected goals for the health sector to address and promote greater sustainability and environmental health. You can see on the screen the 10 goals that include leadership, chemicals, healthcare waste management, energy, water, transportation, food, pharmaceuticals, buildings, and purchasing. And today's webinar is focused around the goal of energy, to implement energy efficient and clean renewable energy generation. For all of the goals, new members choose 2 goals to make progress on in the next year and report their successes through case studies on the Connect website, our social media platform, which I'll share with you in a moment. Currently, GGHH has 743 members from 42 countries, representing the interests of over 20,000 hospitals and health centers. And you can see on the map the countries that are active in GGHH, with new countries coming on board on a daily basis. There are many programs and benefits for members in the Global Green and Healthy Hospitals Network through our 10 sustainability goals. We have the 2020 Healthcare Climate Challenge, a new data center called Hippocrates to measure and monitor and track progress on your environmental footprint, the online social media platform called GGHH Connect, online education such as this webinar and other webinars that are available on the Connect website, and guidance documents, checklists, and other tools for measuring and monitoring progress. A quick look at, here are some of the guidance documents members will find on the Connect website. Each guidance document contains an overview of and a global perspective of each goal, suggested action items, example case studies of people who have good practice examples for the action items, strategies and tips for implementation, and additional resources and references. Webinars such as this one occur about every 6 weeks. This is the first webinar of the year for GGHH, so welcome. We also have webinars through our regional offices in Europe, Asia, and Latin America. And you'll see the number of webinars that have occurred in the last year on screen, and you can find them both on our YouTube website as well as on the Connect site. We have many examples of successful project implementation on all 10 goals from GGHH members. You'll find those case studies on the site greenhospitals.net and on Connect. Part of the benefits of membership include participation in awards, certificates of participation, receiving newsletters, and recording yourself providing a testimonial of how GGHH helps you achieve your sustainability goals. GGHH Connect is our social media platform, also known as the connective tissue of our network. It's an innovative online platform, some call it the Facebook of GGHH, that allows member communities on all 10 goals to discuss with each other and also to access experts to answer questions on particular goal areas. The Hippocrates Data Center is the first international platform of its kind designed for the health sector to measure actions towards reducing its environmental footprint. This new cutting-edge resource puts the power of data management, goal benchmarking, and progress tracking into the hands of each GGHH member. It's housed on Connect, and as you become a member, you develop your online, your profile and advance through the platform to take baseline measurements and track progress. And today, I'd like to introduce the three speakers who are with us for this session, Saving Energy Through Behavior Change, Low-Cost Solutions. The first speaker and primary speaker is Natasha Parker from Global Action Plan in the UK. Natasha is the head of health and well-being programs for the Global Action Plan, leading Operation TLC, Behavior Change Initiative, which is being delivered in hospitals across the UK, and now available tools on GGHH Connect. She's an expert in the science of well-being, holds a Master of Science in Applied Positive Psychology from the University of East London. I would like to now turn the ball over to Natasha, and welcome, Natasha.
Hello, thank you, Susan. Can you hear me?
You sound very clear.
Excellent, excellent.
Welcome. Go ahead.
Thank you. Okay, so yeah, thank you very much. So I'm going to talk to you today about an energy efficiency program we have been delivering across hospitals in the UK, which is all about trying to improve the patient environment whilst also reducing energy bills. So it's called Operation TLC. In England, TLC stands for Tender Loving Care. So we have stolen this because we want to make sure that patients, when they come into hospital, feel that they have the best tender loving care from the staff in the hospitals and from the environment they're in. But we use it to say, turn off equipment, lights out, and control heating. So just a little bit about where I work. So I am head of health for Global Action Plan, which is a charity which aims to inspire people to take practical environmental action. We do work in schools, we do work in workplaces and in the community. But today I'm going to talk to you about the work we've been doing in hospitals. So Operation TLC is really all about getting frontline staff in hospitals to take really simple actions like opening blinds to let more natural light in, turning off light switches, getting the right temperature, and reducing the amount of noise they're making in the day and night to create the most restful and healing environments for patients. But fortunately, these actions are also very good for saving energy as well. So that's what we try and do, to combine those two. So it all began back in 2012 when we were working with one of the largest NHS trusts in the UK, a trust in East London called Barts Health, and they asked us to help them solve a problem. They asked us to look at how can busy, dedicated staff reduce their hospital energy bills. So where staff's focus is really providing the best possible care they can for their patients, how can we get them interested in actually reducing energy bills as well? So the first thing we did was we went out and we went to go and talk to nurses and healthcare workers to look at what are they doing and what are the actions that could change. So we found that there were a high percentage of lights left on, often completely unnecessarily, so left on in unused rooms and left on overnight as well, where they really weren't needed. We found that lots of equipment was being left on, and in hospitals there's lots of kind of equipment that uses a lot of energy and was being left on unnecessarily, so that was wasting a lot of energy as well. We also found that staff were not really taking control of their spaces in terms of managing the heating. Often they didn't have the right controls to do this, and sometimes they did, but they didn't know how to use them. So things like having the heating on and the air conditioning on and the windows open, so lots of energy being wasted. So then we looked at, well, what is stopping people? What is stopping the staff from just doing these simple things like closing windows, closing doors, turning lights off? Why aren't they doing it? So first of all, we found that they simply didn't really understand how their buildings worked. Often they didn't understand how to use heating controls. They didn't know which equipment they could or couldn't switch off. So they simply just didn't do it because they didn't know how. Secondly, there was a lack of expectation. No one had told them they were supposed to, and they all have enough things that they have to remember every day to do. So they just weren't being told, that it was something they should be thinking about. Thirdly, often they would complain that, well, we can't control the heating, or we can't use this air conditioning because the controls are broken. So just simple things that the maintenance of facilities wasn't kept up, then they weren't able to do the things even if they wanted to. And habit and memory. Sometimes they simply forgot. They're busy, they're running around looking after patients, and so they would often just forget simple things like turning a light switch off. So then we looked at, well, what would really motivate staff to take these actions? How can we get them inspired by this? What's going to make them want to do things to save energy? So we went out and talked to nurses, we talked to healthcare staff, and they told us 100% they wanted it. If they could see how it would improve things for their patients, they'd do it. So we looked at different things that might motivate them. And so improving the conditions for their patients was their absolute number one priority. Secondly, they would be motivated by making their own working environment better. So if they could make the environment better for their colleagues, that would motivate them. There were a few green people out there who would be inspired by thinking they're helping to have a healthier planet, but not everyone. You tend to get a few people, and a lot of people that said that wouldn't necessarily motivate them. And finally, they said they weren't that interested in kind of money-saving messages. So very much the order of our messaging was kind of focus on the patients as much as we can, looking at how it can improve things for staff, and they're not necessarily talking that much about why it's an environmental program or how it saves money, because we were told that's not really what would motivate people. So then we went away and we looked at the academic literature. So we thought, right, how can we link this to patient well-being? And fortunately, we found there's a lot of evidence that shows that some of the actions we were asking people to do have a huge impact on patients. So firstly, we looked at kind of natural light, so where we were encouraging staff to turn off the electric lights, open the blinds, let natural light in. We found these studies. So one study found that patients who were in poorly lit rooms in cardiac intensive care had a higher mortality rate than those in sunny rooms. And quite a significant higher mortality rate as well. So a 60% higher mortality rate, which is quite something considering the only difference in the study was the level of sunlight in the rooms. Secondly, another study showed that increased natural light in mental health hospital found that those who were in sunnier rooms actually had a shorter average hospital stay. Again, 3.7 days is quite a large amount. And finally, we found a study that showed us that patients who were in for cervical and lumbar-spinal surgeries, those who had more natural light in their rooms, actually had a 22% decrease in pain-killing medication use. So again, both better for patients, and also you can see there'd be huge cost savings from these outcomes as well. So we went out to talk to staff. So when we'd rolled out Operation TLC, got staff doing these actions, we wanted to know, okay, is this really having a beneficial impact on your patients? So, and fortunately, yes, it was. So, for example, in one hospital, we found that they were still having all the lights on and going around till midnight. So we worked with them to get a nighttime switch-off time of 10 o'clock. So switching off their lights and being quieter and having a nighttime curfew of 10 o'clock. And one of the nurses told us that this morning all our patients were jolly at 6:30. They had had a good night's sleep and were more ready to accept medication. Another nurse in a different hospital told us that Operation TLC has improved the quality of the relationship between us and our patients. So they were really seeing the positive impact on patients by improving the environment they were in. They also told us that they were really pleased to see something being done about staff well-being as well, and that actually by increasing the natural light, having noisy and hot machinery switched off, they were getting less headaches and migraines at work. So really great for the staff were seeing the benefits for themselves too. So in terms of the financial savings we've seen across the hospitals we've worked with, we've helped them to save over £500,000 from their energy bills. So this works out at about 3% of their energy bills. And that equates to around 2,200 tons of carbon saved per year as well, which is awesome. And we think we've underestimated, basically. We've reported the figures that we can actually measure. However, we think, based on the evidence of the benefits you can see from improving the environment, we think there's probably a bigger impact on staff illness, on shorter patient stays and patients using less medication. We haven't measured those things, so we haven't included them in our costs, but we think the financial savings will be significantly higher than what we can actually say based on what we've measured. So we just wanted to give you a little kind of summary of if you were trying to make the business case in your hospital about why do this. So the key things are that it benefits patients, it benefits their sleep, rest and recovery. It has a quick kind of attractive financial payback. It boosts staff engagement and happiness with the hospital conditions. And it's something you can do that shows that you're immediately taking action to address financial overspends, and also that often, financially motivated programs often are seen as reducing the quality of care given, and this is one that actually, you can show that this improves the quality of care given to patients while saving money at the same time. As well as, obviously, what our key goal and motivation is for us, which is about reducing carbon emissions and the environmental impacts. So I just wanted to show you quickly an example of, one hospital in Singapore that we've spoken to has taken this, idea of the environment having an impact on the well-being of the patients so seriously. They've invested millions into building a hospital specifically designed to create the best patient environment. So you can see from this photo, like every bed that is next to a window to have a source of natural light. So obviously, most hospitals, can't start again and design their buildings in this way, but through the actions that we encourage, it's making the best. Using our materials, you can make the best of the environments that you do have. And we wanted to share with you, because, it's all very well asking people to do something, but getting them to do it is often tricky. So we wanted to share with you our secrets that we have learned in how to implement this into your hospital in the most successful way. So firstly, we recommend have a champion in every area. Have somebody in each area of the hospital who can keep this alive, who can encourage and support their colleagues to actually do these actions. Secondly, make sure your staff really do understand the benefits of creating a restful environment. Promote the evidence-based studies so that they understand why it's important and why these actions can have a beneficial impact on their patients. Thirdly, have tailored action lists. So the actions that you take in one ward of a hospital might be very different to another. Some wards need to be warmer, some need to be colder, some need to it's best to not have the blinds open, so it's got to be tailored, and we can't be asking people to do things that are not going to benefit their patients. So make sure that every area has an action list that's tailored to what they're actually doing. Track progress is number 4. So just use quick kind of checklists to walk around, have a look, are there lights on where they don't need to be, are the windows open where they shouldn't be, yeah, just make sure you keep it alive by tracking the progress and feeding that back to people so they know how they're doing. Communicating best practice. So what we encourage is have one big push at the start to get this out. Make sure you've got the senior buy-in, that their support is very vocal. Staff can see that these actions are supported right from the top all the way down to the bottom of the organisation. And finally, make sure that if you don't want this to just be a kind of flash in the pan, and want it to be embedded and long-lasting, make sure it's embedded in your systems and processes. So things like in inductions and trainings. So Blackpool will be talking to you shortly about how they've done this, and they've done it really, really well. So that's it. And just wanted to kind of, again, reiterate the materials that we've used. We've combined with Global Green and Healthy Hospitals. They're available on the website for free on the energy community section of the website, so you can go in and download the materials that we use. So here's just a quick example of one of the posters that we have put on there. So this is just a poster you can download, print off, and use in your hospitals to encourage people to switch off lights and equipment at night. And that's it. My email address is on there, so please do feel free to contact me if you'd like any more information after this webinar. Thank you.
Thank you so much, Natasha. What an interesting presentation. And as a nurse who worked in a critical care environment, I can certainly understand how this can be better for patients. I want to, before we switch to the presentation from Jamie, want to remind you all that you may have questions during the presentation. We'll take those questions at the end of the session. Please go ahead and write your questions in the chat box, and we will ask the speakers. You can address them to a speaker, just ask a general question. C-Suite, our next speaker from the Blackpool Teaching Hospitals of the NHS Trust in the UK, is a project manager. And Jamie joined the Trust in July 2014 and works within the transformation team on long-term strategic and cost improvement programs. She's worked on a number of cross-cutting schemes across the Trust involving the review of patient pathways, workforce development, corporate redesign, and wider estate programs. Jamie studied at the University of Stirling, where he achieved a BA in Business Studies and Marketing, which included a year exchange at the University of Massachusetts. And since graduating, Jamie has worked in a number of different roles in the USA and in UK and in both public and private sector. Please join me in welcoming Jamie. Thanks, Jamie. And you have the ball.
Thank you very much, Susan, and thanks for that interesting synopsis of my history as well. I was keen to learn that. No problem at all. And I would like to say hello to everyone and a warm welcome from sunny Blackpool in the north of England. We're here today to talk about how Operation TLC was implemented at our trust. Susan rightly said, I'm a project manager working within the transformation team, which looks at all sorts of things, including enhancing care for patients, cost improvement strategies for the organisation, and working towards the long-term strategic aims. This afternoon, unfortunately, Carla was unable to attend, so another one of my colleagues from the States team, Graham Fletcher, is going to be presenting with me. He is a building services engineer, and he will take you through the first couple of slides.
Okay, thank you, and welcome to everybody. We are, as you know, we're from Blackpool, which is a seaside resort in the northwest of England. We have a population of about 330,000 people. The trust is predominantly an acute hospital, and it has a total of about 900 beds and employs about 7,000 members of staff. So why did we choose GAP and Operation TLC? We were aware that there was a lot of wastage occurring throughout the hospital. The current culture meant that staff left lights on overnight and in unoccupied areas. Heating and air conditioning were turned on, but windows were open, and scenarios occurring, for example, patient is called to turn up the heating instead of using blankets or closing the door if they were in individual rooms. The annual energy spend for our hospital is about £3 million on gas and electricity, and the prices forecast are obviously going to go up. Actions needed to be taken to improve energy efficiency, but to also change people's attitude towards energy and the energy that was consumed at the hospital. We came across GAP through an NHS Sustainable Development Unit, where there was a case study on the work they had carried out at Bart's Trust. The self-managed team, there was a proven and self-managed team to implement a patient-focused campaign, which was a driver for patients by staff as opposed to just another money-saving project. It was initiated and started originally with a 3-day scoping visit, took place by GAP, using specific audits carried out during certain times of the day and night in different areas. A lot of positive feedback from ward-based staff about wastage and how they would like to improve their environments resulted from this. It was also brought to our attention a lot of staff were unaware of how to use the heating and cooling systems in their area and looked for quick fixes such as opening a window or ringing the estates team to request what action could be taken. During the scoping visit, GAP met with senior nursing teams to present the campaign and detail the patient benefits. This was a crucial part of the exercise as it highlighted the outline of the project and how patient recovery rates could be improved through very simple actions from the nursing staff and the housekeepers on each ward.
Okay, so following that scoping exercise, which actually proved what we already believed, that there was a great opportunity here at the Trust to make some efficiencies in energy usage while at the same time enhancing the patient's comfort and the recovery time, we decided that we would go down the route of commissioning GAP to carry out Operation TLC here in Blackpool. So really it was a question of how do we grab these opportunities and turn them into practice so we can realise the benefits from them. The Operation TLC team came on site with us. They had 12 visits over the course of the year, sorry. There were 2-day visits at a time, and they were engaging all staff on wards. So they came in, they asked the simple question of, do you know how to control your own environment? And start from there, giving advice, education, and using support from the estates team to talk through how to use the lighting and heating panels that are on each ward. It's also important to understand for these staff the impact of making changes to the heating and how long it will take for that to take effect, what the knock-on effect will be in other parts of the hospital as well. So it was really that re-education of people and getting them to take their own accountability over their area and the environment they were working in and the patients they were caring for. So this was done through engaging a variety of different staff. As you'll see on the right hand side in this slide, there was a number of different types of staff that we engaged. Some of them directly relating to patient contact, some not. But the campaign then focused on using specific elements at different times to focus people's mind and to think consciously about their own working area. So just to give you an idea of the impact of that, and so here are some numbers about the programme. And we just felt as an educational project for staff that what we needed to do is reach as many people as possible to make them aware that they could take ownership of their heating and lighting in their own area as well. So as you see, there's a few headlines there. We had, it was We went to 28 wards across the hospital, and this is both medical wards and surgical wards. We spoke to the ward managers, and they became ward champions as well as the housekeepers. The team engaged 800 hospital staff directly. That's either through face-to-face interviews, conversations, or presenting in front of them in meetings. And we reached a total of 4,000 staff annually through the production of intranet materials, staff induction, ward area inductions, place criteria assessments, and social media, as you'll see at the bottom. Okay, so Graham's going to speak now about some of the specific campaigns that Operation TLC ran while we were on site.
Hi again. So we had 3 specific areas, and the first one we looked at was temperature. The issue for the temperature of various wards was that the staff were unhappy with the temperatures, either too hot or too cold, and they had minimal control or no control over their area. Some of it was controlled centrally, some of it was that they didn't understand the controls. So the heating controls were explained to the staff in each area, and a lot of it was very specific to certain areas. Some which resulted in a lot of calls to the estates department to come and control the heating. So GAP designed some various action cards stuck next to the controls to explain how to operate the heating and cooling systems. A specific one was that the air conditioning was quite often turned on, whereas merely leaving it turned off and switching the fan on would suffice. Literature was developed to show the benefit of each activity. So take control, close the doors, close the windows, layer up, keep active, and keep not a fan and need a boost to decide which was the best option for each area. And these signs developed resulted in a 40% reduction in calls to estate to rectify heating problems. The second area which was looked at was the lighting, and as it says on the screenshot, lights out for TLC, quiet time, and nighttime switch off. So there was a lot of wastage around lighting at night time and in unoccupied areas, as well as during the daytime when natural light was available. Patients reported disruption to their sleep due to lighting, and staff were prone to headaches, migraines, and sickness when exposed to too much artificial light. So lights out for TLC focused on switching off lights when not needed and opening blinds to let in natural light. The result was lights were turned off 67% more during the day and 60% more at night, annual savings of over £80,000 on electricity. The quiet time, the second issue was quiet times were introduced on wards, encouraging wards to implement a quiet time, typically after lunch, where lights were dimmed, there were no visitors, and patients were encouraged to gain some rest. And the third issue was nighttime switch off, encouraging wards to have more of a nighttime routine and set a time where they aim to switch off all lights, allowing patients to get a restful night's sleep, resulting in 89% of wards committed to implementing nighttime switch offs. The third area we looked at was high energy consumption areas, such as the path labs, X-ray and general imaging theatres and the mortuary. Stickers were designed which said you can switch me off or never switch me off, which was stuck next to controls on equipment so that the staff were reminded and advised which they could switch off and which they had to leave on. During this, it became apparent that staff members were unaware of the benefits of switching off the equipment, the heat and noise, etc., which could be generated, which could be causing headaches of the staff. One of the main things was the patient environment was improved. 89% of wards committed to implementing the switch off, and patient satisfaction for lights left on improved by 46%. Lights were turned off 67% more often during the day and 60% more often at night, giving annual savings of £80,000. A total of 8 wards were surveyed, and the largest improvement was seen in satisfaction surveys of lights left on. This is surveys from the patients. Patient scores for satisfaction with hospital temperatures improved during the day, improved by 33%, with temperature-related sleeping problems improving by 14%. The quiet time, encouraging wards to implement quiet time, typically after lunch, where lights are dimmed. There are no visitors and patients are encouraged to rest. An increase from 11% to 64% of wards which implement quiet time, and further work will be carried out in the future to persuade other wards and see if they could implement this. One specific item which arose was in the neonatal unit, which was, while working with the staff over there, it was explained by the staff over there that noise and light and heat have a big impact on a baby's health and development, and that staff always try to make the ward as comfortable as possible for them. However, in the ward's side rooms, parents had control of conditions. Staff said it would be great to show parents the importance of creating comfortable, healthy environments for their babies while they're on the ward and once they're at a return to home. So we decided to develop a campaign aimed at parents, not staff. After meetings, we began researching the impact of noise, light and temperature on newborn babies. With staff's guidance and support, this research has been pulled together with our Operation TLC actions to create a flyer that can be distributed on the ward. In Blackpool, our aim is that our Operation TLC and Your Baby flyer will improve conditions on the neonatal unit, and the parents will then take those Operation TLC actions home with them when their baby is discharged. I'll hand you back to Jamie to talk about some money.
Okay, thank you, Graham. Yeah, just to give you some headlines about the programme and what the results were. As you'll see, these will jump out at you. We've got £84,000 saving. This is projected annual savings for lighting and switch off campaigns. Now, how this figure was derived is through a combination of real energy bills received in these, as well as predicted energy usage. Now, the OPTLC team took a baseline sample of the light usage pre-project, and this was carried again at the end of the project following the issue of all the energy efficiency messages. So this is the annualized savings based on the rates that we're paying at the moment. And we've seen that kind of reduction throughout the year. Of course, we can't attribute this totally to the Operation TLC program. Of course, there's energy and atmospheric conditions that will affect this, but we feel that the consciousness of staff in terms of energy usage and heating being on has been heightened greatly by this. There's also some recognisable savings from the reduction in call-outs to the estate teams. Basically, this freed up their capacity to carry out work that we may once have contracted outside of the organisation, so that was a saving for the trust there as well. And finally, there was a significant carbon saving, projected carbon dioxide tonnes, or the equivalent of 483 savings. This was important for an organisation such as ours that is looking to harvest all the efficiencies it can and lower its carbon footprint. Just to let you know about some of the other benefits that aren't quite as tangible, Natasha alluded to it earlier, but we found that patient's comfort is directly related to the recovery time. So important for a hospital to look at its length of stay, and by having the right environment for the patient to recover in the best way they can, ensures that the beds aren't blocked and we can free them up for anyone else who needs to come into the hospital. Okay, so just looking on how do we maintain this low energy culture now that the buzz has been created by the Operation TLC team? Okay, so as you see, we've got TLC champions in each ward now. This is a combination of ward managers that have volunteered and housekeepers. We felt that the housekeepers were an integral part of this, as the ward managers will be main focus will be on patient care, and that might kind of serve up anything else that's to do with energy, whereas the housekeepers not only have the opportunity to go into a ward and assess the environment straight away, but they also will go across the hospital so they can identify when a particular area is cold or warm. Also, we've got lots of materials that any staff can download now as well, showing the stickers to switch on, switch off, educational pieces as well. The patient-led assessment is essentially a patient questionnaire that we carry out to ask about people about their stay, their comfort and their care. We now included how did you feel about your environment, was the wards warm enough, well lit, things like that as well, so we can now monitor that on an ongoing basis. In terms of driving in the legacy and making sure that TLC is available for new staff that come to the trust, we have now got a slide on both the corporate staff induction and the local ward induction. So it's mentioned at both stages for new staff that this is now part of the organisational culture that we're working towards, energy efficiency and taking accountability over your own environment. Lastly, within staff training for new managers, new nursing, again, there's another slide there, and it's recognised and repeated the message that a healthy environment leads to healthy patients and a more happy staff base. Okay, I think that's it today. Thank you very much for listening, and if you have any questions that the end, then I'll do my best to answer them.
Now we're going to move over to South Africa. Cindy Crumpton is going to be presenting her experience at her hospital. Cindy, I just passed you the ball, so you can choose your presentation.
Thank you
and
very
for
much.
other attendees, feel free to ask questions. We're going to run over for 10 minutes, given that we started late. So thank you, everybody, for your patience and for being here. Cindy?
Thank you very much. Good morning, everybody, from Durban, South Africa. I'm going to take you through, we had two subjects for Global Green and Healthy Hospitals last year, water and energy, but I'll talk more about our awareness campaigns for those. So I'd like to just share a bit what our facility is like. Nkosi Albert Lutuli Central Hospital is a public-private partnership between the Department of Health and the Impilo Consortium. I form part of the Impilo Consortium, and the Impilo Consortium works with the Department of Health in three divisions, and that is facilities management, medical equipment services, and IT and infrastructure services. Our hospital is the first public-private partnership in South Africa. We initially ran for 15 years, and we're now on a 3-year extension. We have 846 beds, 23 theatres, 5 ICUs. Our hospital buildings is 200,000 square meters, lab complex 25,000. We have about 3,000 on-site employees and about 600 outpatients coming into the facility each day. And we also have a residential village with 440 units. And there you can see the type of utilities that we are using. This is the GGHH leaders or champions of the various committees that we set up to drive green practices within the hospital. And the head of the hospital is Dr. Thandeka Kanyile, assisted by the PRO of the hospital, John Tusi. And in the second block, you will see our facility, Melanie Maxwell, our department, facilities management, Melanie Maxwell, who's heading up this project, Chris Engler, the engineer, and myself, Cindy Crumpton. So when we got started with this last year, we really felt we need to drive awareness so that all the staff and service providers in the hospital understand what it's all about. There was very low awareness of green practices. So the first thing was increase awareness with all the key stakeholders, the staff, the patients, and visitors. We wanted to inspire users of the hospital to adopt energy and water-saving practices in their daily routines, no matter how small or insignificant that routine may seem. And these were easy wins at low cost. We wanted to challenge DOH staff and service providers to examine their basic operating procedures and adjust them, and there were some innovative solutions. So how we started was we first were involved in setting up committees. First of all, the CEO set up a committee that involved all the hospital domain managers and also the private partner, the Impilo Consortium. And then we strategized on the way forward. We also had a committee for the private partner, the Impilo Consortium, and so that we could see what it is we can do to save energy on site. And then the green team was all the external service providers that contract to the hospital. We had a committee for them as well, and we met regularly. So the features of the first stage in getting started was that we had the committee's regular minuted meetings, brainstorming sessions, use of a tracker template, holding participants accountable for their commitments, and highlighting the best innovative solutions in awareness materials going forward. So with these meetings that we had, we just had a tracker so that we didn't just discuss things. And as people brainstormed, we put down the ideas, and there on the tracker, we would say, for example, clinics to switch off their lights on leaving, and we'd ask them, the division, what are they going to do, what are the action items, by when, and who's responsible. And we pulled this out every time we had a meeting to say, how far are you, how's it going? bearing in mind it was a new concept for a lot of people. So each division had to fill in or had to input into the tracker. Next slide. Okay, sorry. I just want to, we then had a launch event where we drew awareness and had a bit of fun with the staff, and we invited all hospital staff, and all the domains were tasked to put on a little skit or play, design, advertising, design material. And as you can see from this photo, the pediatric ward showed how they were going to go green. They sang songs, and it was a whole lot of fun, and it really created awareness. This is also the launch event where the top photograph on the right is the staff saying how they waste water when they're washing their cars and what they're going to do differently. They made up songs. And because of all this fun and the giveaways that were done on the day, there's people with hands up answering questions and then a certificate awarded at the end. They didn't forget it. GGHH was embedded in their minds. So that was the second step, the launch. We also did a tree planting on the day. There you can see the CEO planting the tree in commemoration for the Global Green Healthy Hospitals initiative. So with the awareness campaign, we focused on the launch, and then posters, awareness stickers, banners, lift cladding, video clips. I just wanted to talk a little about the awareness material. There you see on the left, we have a simple sticker, please switch off lights on leaving. And these stickers are distributed all around the hospital and encouraging people to switch off. We have them in our identified switches. So when our security division do nighttime walkabouts throughout the whole hospital, if the staff have not switched off the lights, then they know which lights they can switch off. So this is participation from our service providers. So the features of this stage was maximum awareness and leveraging relationships, sponsorship. So in case you're wondering how we paid for our advertising, I just want to show you, these are the framed posters that we had all around the facility. So we managed to finance all of this by asking our service providers for sponsorships, the external service providers. We also, the Impedo Consortium donated and that type of thing, because funds were tight and there wasn't really funds for all the various advertising materials. So that's an example, bilingual posters in frame. Then this is the foyer, the entrance foyer of our hospital, and we have these banners in strategic places all around the hospital and in the entrance. And as you can see, they're sponsored by Toyota and so on, and so we managed to get very wide coverage with our advertising. This is the lift cladding. So we did the lift cladding with messages, switch off, unplug, and save water. And all the lifts in the hospital, we have 26 lifts. And this was one of the initiatives that created the most interest and excitement. People were quite impressed with this. Some of them got in the lift and nearly jumped out when they saw this man standing there, life size. But this created a lot of awareness for us, and we managed to get it to stick, which was great. In the foyer, we had a number of points with TVs. So we have video clips running on one of the screens, all about saving energy and water and going green, and that then points to our visitors. It motivates the visitors to save, and also the patients in the area. Focused on motivating all the external service providers like the waste department, the cleaning department, the mail room. We focused on motivating them to change their practices. For example, cleaners. We would say, cleaners were trained, had toolbox talks that they need to look out for unnecessary lights on, switch off their storeroom lights while they are not in it, that type of thing. And then from a, to be aware, we encourage all the service providers that as they work, if they see doors open in passages to the outside, to close those doors. We put up posters to say, please keep this door closed for the sake of air conditioning, and then we were consistent ourselves in closing doors and following up on why doors were left open, and that made a huge difference. So some of the energy and water saving initiatives, I'm not going to spend a lot of time on them. I understand this is the energy focused presentation. With the medical equipment, listening to the previous presentation, yes, some of the staff didn't know which equipment they can switch off and which they can leave on. So we then put up notices at the equipment that can be switched off. Some could be switched off, some had to be left on 24 hours. So notices went up, as you can see in the pictures, and a lot of switching off is now happening that did not before. A lot of equipment was switched on in the morning and never switched off until very late. This is a hand washing procedure. If I can just touch on this, we just identified, I once heard one of the healthcare workers saying the only time they're allowed to waste water is with the hand wash procedure. And I thought about that, and I thought, no, you can actually still switch it off with your elbow. And so they have now changed the hand wash procedure that while they soap and wash, they actually use the elbow to close the tap. And the saving in water is huge, 78% saving. And that's just altering a standard routine. We did the same with cleaning. I won't go through all of this. Just they used to use open buckets, which they changed 4 or 5 times a day. They changed to a top-down system where they throw in 750 milliliters of cleaning fluid into the wand, and that was then going throughout the day. And the saving is astronomical. 98% of the water is saved, but by just changing the equipment. Okay, then the waste department, if you look at the bottom right, the waste department was leaving their compactor on. It was one of those, they arrive in the morning, they switch it on and they leave it on all day. Now they are only having it on when they know that they need it. So they've gone from 5 hours use to 3.5 hours use, saving 11.25 kilowatts per day. And then landscaping had a water initiative where they used aqua soil, which didn't need as much watering, and saving 1,800 liters per week. Other awareness actions we did is to send out information to all on reminding people to switch things off and to not print everything, that type of thing. So these types of messages go out regularly. And our queuing screens have the poster as well about saving water and energy, and the video clips as well. All of the screens within the hospital now have a Save Our Water and Save Energy. So every single user, 1,400 desktops, have that message in their eyesight every single day. And then from the technical team, just before I just go through this slide, is just to say we did embark on this exercise of saving electricity quite a few years ago, in 2015. Oh, that was the water, but before that, energy. So the BMS system was set to cater for air conditioning being adjusted in the winter months and the summer months. Can you hear me? Hello? Okay.
Yes, we can hear you.
You can still, I've got some feedback suddenly. Okay, and then we for water savings, we're taking readings, using trend graphs, and looking for leaks, that type of thing, and then fixing them as they arise. I won't go into all of that, and that's all water, so I'm not going to go into that. Energy saving, we obviously need to understand where on site the energy is being used, so the high demand areas, and working with that. We recorded baseline consumption. We monitored the maximum demand and power factor to reduce the demand on the grid, and we installed electricity meters and energy efficient lighting. And behavior change is making our partners and service providers aware of their consumption and providing guidelines to reduce. For example, that lights need to be turned off in areas not in use. So some of the successes of GGHH 2016 at Albert Luthuli Hospital is increasing awareness. People know what it's all about, ongoing enthusiasm, and some procedures have been permanently changed, saving a lot of energy and water. Challenges were budgetary constraints for technical initiatives. Some technical initiatives like cooling towers and that type of thing can be costly, so we had to be creative there. Sponsorship of media materials, we wanted to go even bigger than we did, but some things didn't work out in the end, but we keep on. Buy-in of long tenure staff that have been around a long time, have always left lights on, have never saved water. Difficult to get their buy-in. We maintaining the momentum. Initially, lights were being switched off, and then after walkabouts, it was clear that it wasn't being maintained. And then some of our lift cladding and signs were vandalized, but we haven't given up. We just fix it and move on. So yes, I think that is mainly creating the awareness, and moving into 2017. We really want to have some more roadshows and more awareness campaigns, and install the principles that we already implemented. We want to increase airflow to our cooling towers. There's a lot of bush around our cooling towers, which we want to clear and increase airflow. That may mean we don't have to build another cooling tower, but that's in its infancy. We want to do rain and grey water harvesting, steam management. We have a lot of water escaping through mismanagement of steam, and then landscaping initiatives. So thank you very much for listening. I hope that some of it was helpful. I've already learned quite a bit from previous presentations.
We have a number of questions that have come in. Continue to put your questions in the chat box. We have about a little bit more than 10 minutes, so we'll cover as many as we can and publish them also on Connect after the webinar is finished next week. I'm going to group some of these questions that have come in. The first couple are for Natasha. How long did it take to develop the program, and have the results of the evaluation been published that we can refer to in order to build the business case for Operation TLC in our facilities? And a related question is, this is all very exciting. I'm wondering if you're aware of Operation TLC being used or something similar in the U.S. and Canada. Natasha?
Hi. Yes. So I'll try and answer all those questions quickly. So the first question, yes, there is a published report that summarizes all the results from the programs we've run in the UK. So I'm happy to send that to anybody who wants it to help you, and that should give you all the information you would need to help build a business case. There is also there was an academic journal article that's been written. I don't think it's quite been published yet, but it's due to be published fairly soon. So that's so that would be helpful as well. And I'm happy to send that to anyone when it's been published. And sorry, what was the third question?
Has Operation TLC been used or something similar in the U.S. and Canada?
No, not in the US, not in the US or Canada. It has been picked up in China. So it's definitely, it's been, so far it's been a UK-based program, but we did go over to China and taught them how to do it, and it's been implemented now in some hospitals in China. And the materials that we're publishing on the GGHH website, I think there are, will be available to download. So if somebody wants to do it in the US, and we're very happy to have a chat with anyone who's interested in doing this, as well as them downloading the materials.
Is the material in China in Mandarin? We have, as you might know, Natasha, a number of members in China.
Yeah, so the plan is we're gonna check if we can get hold of those materials to put on the Global Green and Healthy Hospitals website. They're not, at the moment, they're only available in English. I think there are plans to translate them into Spanish, and we're hoping to get them in Mandarin as well. But watch this space. I'm not sure yet.
Great, thank you. Some questions for the colleagues from Blackpool. The question, were there any challenges or downsides that you encountered with TLC? And in terms of barriers, did staff say, I have no time for that? And how did you deal with it?
Thank you, Susan. Yes, well, first of all, of course, with any of these projects, there's always challenges. But what we took from it was that the staff were really wanting to engage and own their own environment as well. So you have times and busy periods. Some of the wards that we were on, it probably wasn't the best place in terms of looking at this, but it was more about awareness raising. So we still went into the educational piece. It's not a case of being constantly active on that ward. We're talking about high energy kind of usage and high turnover wards, such as ITU wards and cardiac units as well. So we kind of focused on trying to cover as many wards as possible. And certainly there was obviously during busy times of the hospital, people did say that they didn't have time to cover this. However, patient care is really the job of all of our staff at the hospital, and everybody understands that. So if we could put into place a project that proved the benefit to patients as well, then we found the staff took the ownership over that much quicker as well. So as Natasha was saying, it's to focus again on the patient and making their recovery period as comfortable as possible, as well as making staff comfortable in their own environment as well. So maybe initially there was a bit of kind of kickback. However, we were lucky that once we commissioned the project, we had 2 members of the team from Operation TLC come and go to the different wards and do the project. Now, they've had more experience than us at selling this, and as an outside organisation with kind of all their materials, I think they carried a lot more weight through that. So there were some challenges, but I would say that once people understood what the project was about, that it wasn't a lot of work. It was more about going into work and asking, is this the right temperature for myself and for the people that are recovering on the ward? Then people really took it on board. And we had other members of staff that would contact us. We've had, since the project started, members of office staff that have contacted us and said, can we roll this out to their areas as well? So I think the appetite is there within the staff groups, but obviously we work in a hospital that's got very demanding sort of activity levels. So we had to just kind of make sure that we weren't interrupting anyone at that time, and it was to their benefit as well. Hopefully that explains that question.
Yes, I think so. Thanks, Jamie. Another question for, Natasha, did you want to add? I guess not. Another question for...
Sorry, I just I muted myself instead of unmuting. No, I think Jamie's covered it, but yeah, and I think the key is as well, I just wanted to add about, in my presentation I talked about tailoring the actions for the right areas. So where we've run into trouble has been where sometimes if you're trying to just promote an action everywhere. So, for example, quiet times where we've said, turn the lights out after lunch and stop, don't have visitors coming. That doesn't work everywhere. It has. So, for example, in dementia wards in one hospital we were working with, they were trying to encourage visitors to come at any time. So you've got to make sure it's tailored to what's going to work for that particular area of the hospital and what they're doing, because you don't want to kind of clash with any other initiatives. So that would just be one other thing I would add.
Right, not a one-size-fits-all, but tailored to the particular unit and the needs of the patients in that unit as well as staff. Thank you. Another question for Blackpool is, at Blackpool, was there a paid staff member working within the hospital acting as facilitator, or did the champions make it happen on the ground? And a related question is, how were the champions chosen?
Okay, thank you. A really good question there. In terms of having a dedicated resource that was working solely on this project from Blackpool, Victoria, we didn't have that. What we did have is some very kind of enthusiastic estates team members who wanted to improve the situation and the call-outs they were getting. Myself as a project manager helped oversee some of the projects and had regular contact with the team from Operation TLC. But to be fair to them, they had their visits set up, their itineraries. It was almost a standalone project once we'd made those initial contacts for them. So, for example, we would get an invite to a senior nursing meeting, and I would attend with some of the team from Operation TLC, explain what the program is, and once the foot was in the door, then we really had no problems in terms of that. Ideally, we would have had someone here on site that was dedicated to it and a full-time member of staff. Unfortunately, the current climate couldn't offer us that. So that is why it's very important for us to think about the legacy of the program, and is why we suggested ward champions. So the ward champions themselves, they came from a suggestion from the senior nursing team. We asked them what they thought would help embed the program for future years. And they said they really need someone on each ward that would take this forward. But we didn't want this to be a sort of top-down, you'll be the ward champion on this ward. It needed to be someone with that sort of enthusiasm to reduce the energy usage and control the environment. So there was volunteers on each ward, but also there was volunteers amongst the housekeepers. And again, we're not asking these volunteers to do a lot. We're asking them to take notice of their environment, to understand when they can make a change that will improve the environment, and to educate their colleagues and other staff about what they could do to really affect the environment and improve the patient comfort in their recovery time.
Thanks very much, Jamie. A couple of questions around the surveys and the statistics. Did the staff motivation statistics include responses from the hospital executive? And this writer thinks that their highest motivation would be saving money, so how was that addressed? And were patients interviewed or surveyed directly about their experience with Operation TLC at Blackpool? Natasha, maybe you want to start, and Jamie, you can follow.
Yeah, I'm happy to. So we, we used patient surveys and staff surveys to measure and evaluate the impact that the program had on patients and on staff. So some of the figures that Jamie and Graham talked through in the Blackpool presentation, they were from about the improvements in patient experience. They were from those surveys. And yeah, I mean, the kind of senior hospital directors are always going to be influenced by the money saving, but I think what really wins them over is the fact that it's a money saving campaign that also has benefits for their staff and for the patients. So it kind of enables them to implement something that's going to have a positive impact financially, but not only financially. It doesn't make things worse, it makes things better for staff and patients. Does that answer the question? I hope so. Jamie, you go.
No, I'd second that. I think, as you say, a lot of the kind of incentives for these programs are the release of cost-saving measures as well. Now, we're asking people to deliver a program here on ward. So we're talking nurses, ward managers, people that are here to offer the best care they can for the patients. So their main focus is not on saving money, and we never geared it as that to them as well. So all the messages that were sent were all about making people feel better about their own environment. And we knew that if we did this and we could monitor the energy usage, that the benefits financially would fall out of it. So we didn't have to put the focus, as I have done on other projects, on the finances. So it was a really nice kind of, this is for the patients and staff project in terms of improving them, and the benefits from it are a reduced carbon footprint and some cost savings, which is obviously very appealing to everyone in this financial environment. And also, I'd like to say that staff surveys are carried out across the board, so there might have been an element of the executives responding to them, but it was general. The patient surveys, I think, are the crux of that, and we can share some information with you about the improvements on that. But having the patients say that they actually felt that it was quieter in the evening or lights out meant they could get a good rest, and then, you know, they could see their friends and family the next day and have a better kind of visit and recovery time, then that was the key for us on that.
Great, thanks very much. I'm going to ask one last question, and I see that there's a couple comments that have come in. You maybe see them in the chat box, everyone. There's a comment from Katie Cowan that energy behavior is being practiced in the U.S. and Canada since 2007 in hospitals. There are several talks and papers published in Behavior, Energy, and Climate Change, the BEHAVE Conference, and the American Council for Energy Efficiency Economy. Thanks, Katie. And a comment about how there's a common strategy appears to be switching lights off. A more long-term effective strategy may be motion sensing switches in offices and non-clinical areas. So I'll ask the question, do you have occupancy sensors in some places within the hospital? And then the last question is, has there been a change in the ordering of lab testing in order to reduce privacy interruptions at night?
Okay, well, first of all, I totally agree that motion sensors lighting would even provide a greater saving. Unfortunately, we weren't in a position where we could review all our lighting at the hospital and replace it with the motion sensors. And for some areas of the hospital, particularly on the wards, pediatric units, and some of the kind of high energy usage areas, theatres, cardiac units, then it wasn't appropriate necessarily to have motion sensor lighting. But we do have a limited amount of motion sensor lighting here in public areas. So, for example, in the evening, if the corridor is a quiet corridor, that motion sensor lights will switch off. But I do agree that that is a step forward in terms of where we're going in the future. It's just having that sort of capital to be able to put that into practice at the moment. And the second question, Susan, can you just repeat that one for me?
Yes, the questioner asked if there were reduced privacy interruptions at night by changing the order of testing or testing schedule for patients.
And to be fair, we didn't. That wasn't included as part of the program, so we weren't looking at sort of diagnostics and when the board rounds were. Natasha, I don't know if you want to jump.
I can talk a little bit about that. Yeah, we did test that in the original study that we did with Bart's Health. We did look at privacy intrusions through implementing Operation TLC, and we found there was actually a third fewer privacy intrusions after implementing Operation TLC. So it did have a positive impact. And what was the other part of that question? Sorry, it was...
I think Jamie answered it. It was about the motion sensors.
Oh, yeah. And also just to say, yes, we did. So when I talked earlier about having a better nighttime switch-off routine in one of the hospitals, and they had a better close-down routine to turn out the lights in 10 instead of 12 p.m., that they did have to look at some of their routines. So there were still things like medicine rounds coming, after 10 o'clock. So they had to look at some of the other routines in the hospital and how they could be changed to accommodate this. But everyone kind of was working towards the same goal of making sure that patients got the best rest at night. So yeah, sometimes you have to look at what other factors are there and what other procedures are happening that you need to tap into. And on the automatic lighting sensors question, I think Jamie's answered it, but I guess what I would say generally is that there are often some, much better, technological fixes can really provide great solutions, but often you still need to get people to interact with those. So, not necessarily the motion sensors for lights, but we've worked with hospitals who've brought in really fantastic, they've had fantastic building management systems, but then if the staff aren't interacting with them correctly, they don't necessarily make the energy savings that you might want. So this program has been implemented in really kind of old-fashioned Victorian-built hospitals all the way through to really modern hospitals with some of the latest technology. So that's where, again, it's about tailoring the actions to what you need. What do you want people to do?
Kind of for all our participants, it was targeted to Natasha. Natasha, our attendees ask, in terms of barriers, have staff never said, I have no time for that? And if so, how have you dealt with it? And I'm going to mute your microphone right now.
Hello. Yeah. So, I mean, that was often the biggest barrier when we went out and talked to staff. The first problem they always come up with is we haven't got time. We're so busy that we're not going to have time to do this. So we always kind of stress that these actions are so simple, are so small, and should just become part of the daily routine. They don't really take any time. It doesn't take time to switch a light off, and actually that's why we really kind of focus on, if the focus of people's jobs is to provide the best quality of patient care, and that's their fundamental day-to-day, what they're trying to do, that's why we kind of try to build in these types of actions to show that actually what you're doing is taking care of your patients. It's not something extra to do that is something different to what your day-to-day job is. Things like opening the blinds, letting the natural light in, making sure that lights are switched off when they're not needed, so there's not glaring lights, making sure your patients are at a comfortable temperature. That these don't take a lot of time, and actually you can build them in to become part of the core, just parts of your day. And where we could, we've very much kind of tried to work with departments looking at what are their existing routines, what are their existing procedures, and how can we kind of build these into those rather than having it as a separate campaign. Can we build in some of the Operation TLC actions into their existing routines? So that's how we've approached it.
Thank you very much, Natasha, for your answer. We have a question now for the Blackpool team. The question says, was there a paid staff member working within each hospital acting as a facilitator, or did the nurse champion make it happen on the ground?
Okay, yeah, thanks very much for that question. Just to give you an idea, basically, we came up with the idea in terms of speaking to Operation TLC and then put it forward to the senior nursing team who agreed that it'd be a good project. We do obviously need some support from the internal staff on the ground. However, when we commissioned GAP to deliver the project, they were essentially running the project themselves and needed support from us to get into some of the meetings with more senior staff and to get access to more wider kind of circles of meetings with staff as well, so audit meetings, kind of divisional meetings as well. In terms of running it on the ground, we kept the senior nursing team involved in terms of we sent them monthly updates after every visit, and also spoke at a couple of meetings with them. But once they gained access to the wards and had one or two visits, then people were aware of what they were trying to achieve. They were wearing bright coloured T-shirts to signify them apart as well, what they were trying to do, handing out kind of all the materials. And for those 2 days, they had an itinerary and ran it themselves as well. So while initially there was some work involved with scoping out the project, kind of getting sign-off from our internal kind of masters here as well, then once they were on site, the support that they required was really from the estates team. just asking sort of what was the potential of what we could do, what we could support on, and then possibly setting them up with proper meetings with maybe the theatre staff manager or the mortuary manager. So it was very much run by Operation TLC, but overseen by us. So we didn't have a specific person with them all the time on site. They were quite autonomous, but there was a good connection, and we had phone calls every 2 weeks. So we were updating and seeing where we were with the project, making sure it was achieving its aims. So it was part of a portfolio of projects that I'm working on, but there wasn't a dedicated resource for this particular project. Carla, I don't know if you want to answer any further. Are you happy with that?
Yeah,
okay.
no, good, Jamie, thank you.
Thank you very much, Jamie. And one last question for Albert Luzuli. Cindy, it's when you were setting up your working committees, if you encountered any barrier in involving the hospital management, and if so, how did you overcome these?
No, in this case, the CEO was on board from the beginning. As I say, though, the awareness of green practices wasn't very high. So we didn't have a lot of resistance, but there wasn't a lot of knowledge about green practices. So we had to, share, and through the launch, we achieved a lot. But no, the CEO was on board from the beginning.
You'll see the slide on screen of how to become a member in the network of Global Green and Healthy Hospitals. We welcome you. We were unable to answer all the questions, and so we will take a question or two to the energy community on Connect and encourage you to visit that community and continue this discussion about how to engage and motivate staff in energy efficiency mechanisms in hospitals. And a reminder that after this webinar, you'll receive in your web browser a survey, an evaluation survey. Please fill out the survey. We are very interested in your comments, both about what you thought about this webinar and what your recommendations for future webinars for GGHH. We look forward to seeing you next time. Thanks very much. Have a good day and a good evening to those of you who joined us from Europe, and a good day and afternoon for those of you joining us from North and South America. Goodbye, everyone.